My name is Jonathan Hutter, and I'm a board-certified plastic surgeon at Proliance Plastic and Reconstructive Surgeons. I completed my undergraduate studies at Georgetown University in Washington, D.C., and then I ended up back in my hometown in Boston, where I earned my MD at Harvard Medical School. After that, I headed to the West Coast, to Seattle, where I joined the University of Washington Integrated Program in Plastic and Reconstructive Surgery, which to this day is one of the top programs training residents across our nation. This included rotations at Harborview, UW, Children's, Seattle VA, and right here at PNRS. Our group was founded in 1971 and have been a part of the University of Washington training program since its beginning. And I am honored to continue that long affiliation as site director and associate clinical professor for the University of Washington Division of Plastic Surgery. I love my job. I think the field of plastic surgery can be hard to define, even among our colleagues. Most people consider us cosmetic surgeons, which is a big part of what we do. But we're also involved in complex reconstruction, including craniofacial, microsurgery, hand surgery, and soft tissue management. We work with all surgical specialties and work all over the body. But despite this range of our field, the principle of what we do remains consistent: form and function, creating contour and proportion of the human body, bringing about restoration and healing. It is an absolute privilege to use my mind and my hands to help others. What I am most passionate about in my work is my patients. Physicians talk about outcomes, and we try to quantitate metrics of patient satisfaction and quality of life. I do think these metrics are crucial to the science and development of medicine as a whole. But seeing this firsthand, almost daily, with people that you care about and have helped, there's no greater feeling. We are a little unique in our field in that we often have long-term relationships with our patients, including their families, friends, and communities. It's not always an easy path. There can be hard times and tears. Despite my best efforts, perfection remains elusive. But without a doubt, I know it's been a great day when I know I've helped a patient through a hard time and I see them smile at a follow-up clinic visit, or I see someone regain their confidence. When we get to a point where we can laugh, share stories, and look forward to what the future holds, at this point it's no longer work. We joined Proliance in 2014 as the first and to date only plastic surgical care center. For over 50 years, our group has maintained a very successful cosmetic practice while serving our hospitals and community for all reconstructive needs. In doing so, we have maintained a high level of education and experience for the UW plastic surgery residents that have rotated through our program. This type of practice is unique, and with the changing tides of healthcare, we knew that carrying this torch forward would be nearly impossible in isolation. I also came to realize that some of the most established surgeons in our communities were part of this Proliance network, and that some of the very best residents that I trained with had become Proliance surgeons. The strength of this group is the quality of the care centers, the physicians, and all of the healthcare workers that strive to bring the highest quality of care to all the communities within our state. To achieve this, we rely on the extraordinary effort of our administrative leaders and teams to navigate a very complex and scrutinized healthcare system. Exceptional healthcare, personally delivered. I think for a tagline, it's pretty spot on. I look forward to our future as Proliance Plastic and Reconstructive Surgeons.